Hi, I'm Dr. Jack West. I'm here in Huntington Beach, California at the 2019 Lung Cancer Congress, and there's been wave after wave of data coming in. With all of the information out there around PD-L1, you may be wondering whether a patient who expresses PD-L1 can also have an actionable mutation. The answer is yes. Driver mutations, like EGFR mutations and ALK rearrangements, are examples of genomic alterations, and nearly 100% of the time, they do not coexist with each other. PD-L1 expression is not a driver mutation. It is a measure of the amount of PD-L1 protein on the tumor cell surface. PD-L1 expression can and does exist in patients who have driver mutations, as seen in the ImmunoTarget study. ImmunoTarget showed that between 33% and 100% of patients with various driver mutations expressed PD-L1. An actionable mutation is like a lock that we have a key for. When you match a targeted therapy to patients who have the mutation it targets, we see a clinical benefit in the 75% to 93% range. The guidelines reflect the evidence. In fact, guidelines recommend testing all of your patients who have non-squamous metastatic non-small cell lung cancer for EGFR, ALK, ROS1, BRAF, and NTRK, and then treating based on the results. 1/3 of patients with adenocarcinoma could have an actionable mutation and therefore should receive a targeted therapy, not immunotherapy or chemotherapy, as their first-line treatment. With new data coming out, the list of actionable mutations and the proportion of patients who have one are likely to grow. The reason we test patients is that there are so many who have an actionable mutation. So we want to identify this subset of patients and get them started on targeted therapy as early as possible. For my patients with metastatic non-squamous, non-small cell lung cancer, there is a growing array of clinically valuable driver mutations to identify that have high response rates to targeted therapy. It is most important to identify these patients before they start first-line treatment. That's why the strategy of testing broadly for mutations during initial workup is the optimal approach.